Hello and welcome to October's COVID and Wellness Update from Prisma Health Business Health Solutions. I'm Dr. Rachel Brown and I'm the Medical Director of Prevention and Wellness. And the good news is that we are starting to see a decline in the number of COVID infections in our country and in our state. This is due to many factors. The first is that more folks have gotten immunized. The other is that more folks are wearing masks. We've also been testing more, so our surveillance is greater. And for better or for worse, there is a higher level of natural immunity now because of that vast number of infections. Some people did well with their COVID infections, and unfortunately, many others did not do well. Let me share with you my screen so that I can show you some of the latest DHEC data concerning our county's rates of infection. And so each week, day, really, DHEC will update our county incidences. You can see this is accurate as of 2 days ago. And we have moved into mostly moderate disease activity. We had been in the high disease activity categories throughout our state, and now we only have one county, Union County, in that high rate of disease activity. That's important because if you remember, for fully vaccinated folks, the CDC recommended that those vaccinated individuals, while in public indoor places, remain masked when they were in an area of high incidence. What I caution you and others to consider is that even though we have moved out of that high incident rate and more into a moderate incident rate in South Carolina, it may not be time to relax those masking practices just yet. We certainly want to do everything we can not to revisit a surge of this type. We're already trying to win the race against the development of additional variants that may or may not be, we may not be protected against with our vaccinations. And we need to do that by stopping the spread. And so continuing to get folks vaccinated, but also continuing to mask is very important. So I do want to make clear that while that is the official CDC recommendation, we really should just keep doing what we're doing because it is working. I also want to show you that Prisma Health will post its inpatient hospitalization information each day. They haven't posted for today yet, so you're seeing October 7th's data. But what I want you to pay particular attention to is that this is still very much a pandemic of the unvaccinated. So of all the folks in the hospital as of yesterday for COVID, only 11%, and on average, this is about 10% of those folks were vaccinated. Of the people who get very, very sick, of our patients in the intensive care unit, right now only 8% of those patients were vaccinated. Everyone else was unvaccinated. And of our extremely ill patients who are on ventilators with very high risk situations, only 4% of those ventilated patients were vaccinated. So unvaccinated folks are the ones who are incredibly much more susceptible to this virus. And so we need to continue to encourage vaccination. So let's talk about that a little bit. We're going to go to the vaccination dashboard for South Carolina. In the nation, we're at about 73% of folks who've at least received one dose. If you look at other data of a vaccine, other data, it's closer to 81%. In South Carolina, we have about 53%. We finally made it above the halfway mark of our folks who are fully vaccinated, and about 61% of folks who have gotten one shot or in the middle of that process. So we're getting better. This is still not enough, right? So we need to get these numbers up if we want to prevent another Delta type surge from happening again. Now, one thing I will say, again, I've mentioned this before, we do want to continue wearing masks for folks who are vaccinated. Please continue to do that in public places. It's just the right thing to do to keep this under control right now. But also, if you are exposed to someone who is diagnosed with COVID and you're vaccinated, you do not have to quarantine. The CDC and we recommend that you wear a mask for 14 days and watch very closely for symptoms. You can also get tested around the 3 to 5 day mark. And if that test is negative, you may feel a little more comfortable not masking if you know that that test is negative and you don't develop any symptoms, excuse me. So let's talk a little bit about booster vaccines, since that is the hot topic right now. I'm going to flip on over to the DHEC COVID booster page, and you can see here that the FDA has given EUA, emergency use authorization, to Pfizer to administer booster shots. The American Council on Infectious Immunization Practices did not necessarily agree that there was the data there to show that it was going to add any benefit. However, CDC agreed with the FDA and finessed these recommendations. And so these are the folks who are eligible for a booster shot. If you're 65 years and older, absolutely. We feel that possibly either your natural immunity to a previous COVID infection and or your immunity from the vaccine is good, but could be better, and you should probably have a booster shot, as well as anyone over the age of 18. So any adult who's in a long-term care setting or group group living situation, or who have underlying medical conditions that put you at risk. So there's a whole category of folks who we know we were giving a third dose of the vaccine to, and I'll talk about that in just a second, who are immunocompromised. But also if you have diabetes, if you're a tobacco user, if you have overweight or obesity, then you would be at higher risk from complications of a COVID infection and should get a booster. Now, remember, these boosters are given 6 months after your second shot of the Pfizer vaccine. Now, there is a group of folks who may want to get the booster, and they are adults who are in high risk working or living situations. So if you are confused about who that means, scroll down to the bottom of the page. They give some great examples of who these folks might be. And of course, anyone on the front line of care, teachers and other folks who are in educational institution, folks who are in customer service, manufacturing, grocery store workers, postal workers. Lots of folks are going to be having a lot of contact with the public, and they, of course, would be at higher risk. So pretty much anyone can get the booster now. And so just as a reminder, 6 months after that second shot, you can get a booster. Now, what about Moderna and Johnson & Johnson? Well, on September 1st, Moderna submitted their data to apply for EUA approval for a booster of their vaccine, and recently J&J has done the same for a second dose of the J&J. The plan from the FDA is to have meetings on the 14th and 15th of this month, and additional guidance they're anticipating will come out on October 20th around getting booster shots if you had the Moderna or the J&J vaccine previously. Now, I do want to tell you, just to clarify, in case you're getting a little confused with some of the terminology, there's booster shots, and these are the immunizations that are given at that 6 months interval. But there's also something called a third shot, and that is reserved for folks who are in those high risk immunocompromised categories. So people with cancer, folks on chemotherapeutic drugs that will suppress their immune systems, folks who are on high dose oral steroids every day, the category we talked about before, they can get what's called a third shot. And the difference there is that they can get that shot 28 days after their second shot. So really think of that as kind of a 3-shot series as opposed to a booster. Now, a lot of folks ask me, well, gosh, if we need boosters, does that mean the vaccine doesn't work? And that is absolutely not true. And I want you to think about when you were younger, or if you have children, how many times we give booster shots in immunization practices. It's very, very common, and it's a way to boost the immune response. But I can tell you that the vaccine, even without the booster today, is very effective despite immunity waning slightly. It is still incredibly effective at preventing hospitalizations and deaths. So that's what's important, right? So let's talk about the last aspect of vaccines that I get asked a lot about, and that is, what about our kids? We're still waiting to hear about that 5 to 11-year-old approval for vaccinations. So on September 28th, Pfizer submitted their request for EUA approval for 5 to 11-year-olds to start getting the vaccine. They are meeting several times this month to talk about this over at the FDA and the ACIP, and the plan is on the 26th of this month to have a big meeting to give us some guidance around that. There's been some murmurings that we may have a final decision before Halloween on our 5 to 11-year-olds. Now, the last thing I want to say about vaccines is not about the COVID vaccine, it's about the flu vaccine, and it's flu season again. If you weren't bothered by the flu season last year, it was because we did a great job of social distancing and wearing masks and hand hygiene, and that's how you keep an infection from spreading. So we didn't see a really big flu season last year. Hopefully we won't this year either for those same reasons. However, we know that we're not masking as frequently and we're not social distancing in the same way. So please get your flu shot. We want to mitigate a busy flu season for a few reasons, and the most important being flu can put you in the hospital as well, especially if you're at high risk. Flu plus COVID is going to be disastrous for many people. And also, with the burden on our healthcare system being what it is right now, we really want to try to keep people well. We may be seeing a lower trend in our COVID numbers across the state, but we are still taking care of very, very sick people in the hospital at very, very high numbers, as you saw before. And we need to be able to provide access to care to everyone, regardless of whether they're coming in for COVID or otherwise. So keeping you healthy and out of the hospital is even more important right now. Let's talk about breakthrough cases, because I still get questions from folks who say, well, if you can still get the infection even after getting the vaccine, why bother getting the vaccine? And I've already shown you our inpatient numbers here in the Prisma Health System, that it's much, much less likely if you are vaccinated that you end up in the hospital, and extremely unlikely that you will be in the intensive care unit or intubated or die from COVID if you are vaccinated. But let's look at the actual numbers. We've been tracking this a little better in our state right now, and you can see that the percentage of fully vaccinated folks who've had a breakthrough infection in the hospital or out is 0.5%. Very low. So we're hearing more about people who are vaccinated who have breakthrough infections because we have more people who are vaccinated. So the relative number is going to go up. 0.5% of 100 is much lower than 0.5% of 100,000. However, the percentage is very, very low. If you look at the percent of fully vaccinated people who are in the hospital or die, it's 0.05%, so extremely low. So it's very valuable to get your vaccine, whether you think you're going to be get a breakthrough infection or not. And let me also remind you that if you have had COVID before, it is still important to get your vaccine and even to get your booster shot, because you will have developed immunity to the strain that you caught, but you won't have developed immunity for the other strains. And there is some conflicting data about how effective our natural immunity is versus the immunity that we get from the vaccine. All right. So one of the things that I did want to talk to you about is I get questions around, well, wait a minute, the data is showing that our immunity is waning, and that's why they're recommending this booster shot. And so there can be some confusion about whether the vaccine is effective or not. And as I mentioned before, it is still remains highly effective against hospitalizations and death. But let me explain a little bit to you about why we see a difference between the vaccinated and unvaccinated folks. So everyone can be exposed to the COVID virus through their nasal cavity, through the lining of the nasal cavity. Vaccinated folks develop something called mucosal immunity, which means that in the lining of that nasal cavity, they can fight the infection directly. Okay, not every time, it's not 100%, but they are at they have much better chance of clearing that virus before a symptomatic infection takes hold than someone who is unvaccinated. Then, if the virus does happen to get past that mucosal immunity, which also happens a little bit in our lungs as well, the antibodies that a person develops when they are exposed to the vaccine or when they receive the vaccine, those antibodies keep the virus from entering human cells and, most importantly, respiratory tissue, right? So that's how that immunity works. If you're unvaccinated, you don't have those two lines of defense. Also, in terms of transmission, when we look at whether a vaccinated person who is exposed in their nasal cavity to COVID, can they transmit that virus? First of all, their levels of virus tend to be very, very low because of that immunity that we discussed. The virus, excuse me, is not able to replicate and spread like it can in someone who doesn't have mucosal immunity and antibody immunity. And also, they don't have the symptoms that cause that forced expiration, like coughing and sneezing, that can also spread the virus. So there is a sense that the transmission from vaccinated folks to all others is much lower than from unvaccinated folks to others who've been exposed to COVID. And there's even a recent New England Journal of Medicine article that shows that data and that correlation there. Last thing I want to talk to you about today is, I'm going to stop sharing my screen for just a moment. Come back to you. It's something called post-COVID syndrome or long haul COVID. And I've talked to you about this before. And what we're seeing is that about a third of folks, 1 in 3 people who get get a COVID infection, whether they're hospitalized or not, whether they have a mild case or not, have persistent symptoms that affect their quality of life. And this can be from anywhere to 3 to 8 months. And we've even seen it past a year in some folks. In a recent survey of folks who were COVID positive, 36% of those people, so over a third, said that they felt worse a year after or a year later, somewhere between 6 and 12 months later, than they did before they had COVID. So this is really impacting people's quality of life. About a quarter of those folks are experiencing profound fatigue. And what we're seeing in most of them is a deconditioning combined with respiratory compromise from the attack of that virus. And so they're unable to take stairs. They always feel short of breath. They always feel tired. They have elevated heart rates, and they're just struggling trying to get through their day. Other really common symptoms are headache, persistent headache, and of course that loss of smell and taste. And I was speaking with someone the other day who was about 7 months out from their infection. They still could not smell or taste, and that really does impact your life. We sort of think to ourselves, oh, no big deal, it's not life-threatening. But if you really thought about what that would mean in your life, that would not be fun. So we want to avoid COVID, but the other thing that we're seeing more and more data on is that these symptoms improve when folks get the vaccine. So lots of reasons to get the vaccine. Finally, I wish I had more information for you about the potential mandates that may come requiring you to require your workforce to get vaccinated or to have weekly surveillance testing. We are still waiting to hear from the government and from OSHA on what that looks like exactly, what kind of testing would be considered adequate. What other sort of benefits do you have to offer in terms of pay to get these things done? But what I can tell you is that we are watching closely. We have been working with organizations to give them advice on how to manage a testing load like that, whether that's on site or with third-party vendors who can help you with that kind of surveillance testing. I do want you, and you've probably already thought of some of these things, but as you're sorting or you're looking forward towards what may be coming, you've probably already figured out that it's more cost effective to have your population vaccinated than it is to test weekly the unvaccinated, especially if you have a very low rate of vaccinations or vaccinated folks among your workforce. But also considerations logistically. So we find that a lot of organizations aren't really prepared to offer weekly testing, certainly on site, but even what that will mean for workflow when folks are having to visit, third-party testing sites to get that done. And of course, you have to consider, are you only going to test for surveillance, or are you going to become a testing center or offer testing for folks with symptoms? And that means an entirely different setup where you have where you keep those folks isolated, and the testing has to happen in a safe, clean space and away from everyone else. So there are many things that I know are on your mind that you're considering as you wait for these recommendations, and we're here to help you tease all of that out, and help you point you in the right direction so that you can get the resources you need. Nothing's going to have as big an impact as vaccines. We need to win the race this time and treat this last surge as a big lesson that we want to get out in front of this before more variants hit. So as always, please reach out to us with any questions. We're happy to talk with you, your leaders, your workforce around vaccinations, about testing, quarantine recommendations, and so forth, booster shots. Please reach out to us for any of those questions. We're here to take care of you so you can take care of your workforce.